A lack of access to mental health providers is an ongoing issue for rural Minnesota communities. It's a shortage that has significant and even deadly consequences. KIMT News 3's Brandon Cote is joining us now after spending the day at a Freeborn County community forum. Brandon, you spoke with an Albert Lee mother about her firsthand experience with the issue. What insight could she offer?
Well, yeah, Jess, I had the opportunity today during the forum to speak with Kim Williams from Albert Lee. She tells me her son went days without life-saving mental health treatment. Williams says it inspired her to become an advocate for mental health resources so other Freeborn County families don't experience the same lack of care. Mental health advocates in Freeborn County are working to increase access to providers and resources in rural areas.
I have trouble sleeping at night. I do. You just kind of worry about all this.
It's an issue Albert Lee mother Kim Williams knows all too well after spending 4 years watching her mom, son, and grandchild suffer from different mental illnesses.
There's been almost every year somebody in my life that I've had with a mental crisis of some kind.
Williams says her son's severe depression left him hospitalized, but without a long-term care plan.
It seems like there's not a lot of institutions or places for people to go.
She says the lack of beds at nearby outpatient mental health facilities left no other option than to remain at the hospital, waiting 3 days for treatment that never arrived.
He's better now, but it wasn't because he got any kind of help. It's scary, and I think that's what happens with people that commit suicide. They get sent home.
Then the lack of mental health resources in Freeborn County was obvious again when Williams says her mother was hospitalized in an accident and doctors failed to treat her mental illness virtually.
It was remote, and this guy is diagnosing her mental health. Like, you know what I mean? It's just things have changed.
She says it's past time. Solutions were discussed to combat the mental health provider crisis.
Yeah, I think this is great. I hope something comes of it.
Williams shared her experience with me following the forum to highlight the individual impact the shortage has in Freeborn County. However, a panel discussed the overall mental health challenges in the county. Those include rural mental health being one of the lowest paying fields within healthcare, and not enough internships in rural places are available to high school students to familiarize themselves with the career in mental health.
Thank you, Brandon, for that in-depth look. The Albert Lee Healthcare Coalition is planning to host another community meeting this Sunday at the city's fire station. It will take place from 4 to 5 p.m. and the discussion will focus on the future of healthcare in Freeborn County.